Recording
Good to
in
see you
progress.
all. How are you? Good. Busy week.
Yeah, busy week, busy day as well.
Yeah, that's good. Keep it busy. All right. So today we are going to do a new unit as well. So this unit we're going to divide it into 2 weeks. So today we're going to do half of this unit, and then we will finish this unit by next week. As you may already see your learner guides and the PowerPoint slides, we do have we do have 3 parts for this unit. So this week we're going to finish part 1 and half of part 2. Then we will finish part 2 and 3 by next week. All right. I think you guys do remember that in the last couple of units we have discussed something about the legal and ethical considerations or legal and ethical requirements. Do you remember that?
Yeah.
Yeah, so this unit is what we're going to spend our whole day to go through all of this. So in previous units, we have briefly explained each of the legal and ethical considerations, but this unit we're going to spend more time to discuss with you guys one by one, and make sure you guys do understanding all of those requirements for us working in aged care and also for disability services, right? And make sure we follow all of those legal and ethical considerations and when we start working in aged care industry, right? So are you able to see my PowerPoint slides properly? You can see the slides moving, right?
Yeah.
Full page? Okay, that's good. So show you a bit the introduction of this unit. As we say, it is legal and ethical consideration. So we definitely going to focus on these 2 parts. The whole chapter 1 is we're going to discuss focus on legal parts. So as you know, for legal, it is related to the law and also the regulations from the local council, from the state governments and the federal governments, right? So we're going to discuss deeply regarding the legal consideration, and also the second part is to focus on discussing about ethical. How does that's related to our human value of rights, and also what is right and wrong, why we need to do it in this way, something like this. Right? Sorry? Did someone try to asking something? Yes, Audrey?
No, it's not me. I don't think so.
Oh, okay. All right. So as you know, not everything ethical it is written in the law, but it is still important for us what is the ethical requirements for us working in the industry. But firstly, we must fully understanding what is the legal requirements for all of us. Anything you can think of, it would be our legal requirements working as a aged care worker.
The privacy.
Yeah, privacy. What else? Privacy and
Privacy discrimination.
privacy. What is the full term of that privacy? It's not only privacy. There are 3 keywords about this. Privacy and start with C. What? Confidential, right? Privacy, confidentiality, and disclosure, right? That is the full term of this legal requirement. It is privacy, confidentiality, and disclosure. This is the full terms of these requirements. Other than privacy, confidentiality, and disclosure, anything else you can think of on top of your mind as we have discussed it number of times regarding the legal considerations? Anything else you do remember? Not even one? Check your notes. Did you make any notes?
Is a care quality standard count?
That is not that is not a full consideration, but definitely we do need to follow that. But what is other terms that to mention to you regarding the legal requirements as a aged care workers? What else do you think that would be related to our laws and legislation?
Duty of care.
Sorry?
Duty of care.
Duty of care? Okay, yeah, excellent. Duty of care, correct.
Dignity of risk.
Dignity of risk, perfect. Yeah, dignity of risk, good. Anything else?
Reporting. Mandatory reporting.
Mandatory reporting, excellence, great. So I can see that you guys do remember some of them, right? So we're going to discuss in a bit more details to help you to identify what are the legal requirements you must understand, and also according to those legal requirements, right? And I think before we start go through all of those legal and ethical requirements, we would firstly help you to understand where I can get those information from. If I want to find out more about the legal requirements, where can I find those information? So this is our first part, is helping you to identify and you know where to access and how to interpret all of those source of information about the legal requirements. For example, when I'm asking you what are those legal requirements are, if you do need to do some research, you probably need to find out where can I get those information from, right? So the first we can let you know is probably you can check some international organization. They will probably also publish some of the informations about legal requirements globally. For example, you can get those information from the United Nations, or even though related to us, it would be the WHO, World Health Organization, right? WHO, right? Those organizations, international organizations, they do publish a lot of information regarding legal requirements. So as you can see, for the international organization has 193 members country, of course, including Australia. We do follow those international law, and also that's definitely promotes peace, dignity, and equality for all humans, right? So we do need to understanding that firstly we can find those information from those United Nations or from the World Health Organization. And also now back to Australia, then definitely we do can get some information from legal information. I mean, from the Commonwealth government, right? Like we always say, the federal government. So they do provide those national laws and related documents. For example, the whole Australia, we do have, regardless different states, right? We do have the work health and safety legislations. We always mention that as aged care workers, we do holding our duty of care, that it's one of our legal obligation, etc. Right? And also you can find legal informations and also the requirements from the Commonwealth government's official website, right? So, for example, the Department of Health and Aging, that is the government's official website. So, if there's anything related to health and aged care, definitely you can find a lot of information from their official website. For example, a few days ago, on 1st of November, as you're all probably aware, that the new Aged Care Act has been started, right? And there are so many changes in aged care. I would strongly recommend you guys, if you haven't, go to the website from the Department of Health and Aging. I will strongly recommend you to go and have a look what are the changes of aged care, what is happening in aged care nowadays. Also, the new Aged Care Act The new aged care standards is also started from 1st of November. Right, so I think in the previous units I did show you the new aged care standards. They changed from 8 standards to 7 standards now, and there are heaps changes. So that's all those information you can get from the government's website, right? So those are the two you can getting the source of information from. And definitely you can get relevant information from the states or territory governments websites, or even though you can getting different informations, not only the aged care information, you probably get something relevant, such as like we mentioned earlier, the work health and safety, etc. Those you can get those relevant information from the state government's website. And everyone, I know some of you working or living in different states, so make sure before you start working in your own states, you need to check your local state's legislation, because as you know, some of the legislation, it would be slightly different, or the requirement will be slightly different by state. All right, so you need to check firstly your role, and also what is the legislation or laws applied to your role, right? Even though, for example, work as registered nurses in New South Wales, probably it would be, the requirement will be a bit different compared to working in Victoria or Queensland or Northern Territory, right? So you do need to make sure you're checking what's the laws apply to a specific role in your state, yeah? And definitely, we do have different policies and regulations in our local governments as well. So, for example, like during COVID, different councils, they do have different requirements for social distance, right? Something like this. In some councils, they may say you need to keep 1.5 meters away from each other. The other council may say, oh, in the lift, it's only allowed for 2 people in one lift, etc. Right? That is also the local government regulation. So you do also need to check. For example, you're working in, let's say, one of the New South Wales council, then you do need to check what's the relevant information or legal requirements for you to working in that area, because may have policy and regulation relevant to your job, right? And you can also definitely visit your local council's websites for more details, yeah? So that is from the governments. And also we can get more and a lot of information from the regulatory agency, such as the Aged Care Quality and Safety Commissions, right? So they are the regulator and also following the Aged Care Act, and they are regulating and make sure we are compliant with all of those legal requirements. And they are also the group of people coming to your aged care facility to do the site audits for your organization and facility, right? And when they're coming to visit you, they will interview the staff, they will interview the residents, they will definitely check a lot of your paperwork, your documentation, following the new aged care standards to see if you are compliant with all of those legal requirements, right? So that's why it is important for all of you to understanding each of the legal and ethical requirements, because that is what they actually auditing you and checking on you, right? You may think, oh, I am just the aged care workers. The manager will answer most of the question. Nowadays, it has changed a lot. Even though one of the auditors are coming to ask you some question, let's say regarding duty of care, right? If you are unable to answer their questions, you will probably put in your whole facility as non-compliance, right? Because they identify probably one or more than one staff, they don't know what duty of care is, and they don't know what to do in duty of care. Then your organization will have the problem, right? Because that is one of the key legal requirements for all of the staff. So make sure you're familiar with the aged care quality, the new aged care quality standards. Yeah, I believe if probably once some of the students they have already started working in some of the aged care facilities, I'm sure your employer would start have already starting showing you and explaining to you about the new aged care standards. If not, please go to the aged care quality and safety websites and start learning about the new aged care act and also the aged care standards, right? And also definitely you can get a lot of relevant informations, especially the legal requirements from the industry associations, right? Such as, like we say, what will be there? So, for example, your union, yeah, and I think I did mention to you guys previously. I would recommend you guys in the future if you start working as in aged care, you probably need to join a union. They will always give you some updated information. You can subscribe their newsletter, etc. They will post all of those updated information to you. And if in case if you need any help, then they can also be a supporting person, right? So you can get some information from them as well. So those are the source of legal information you can get from international organizations, federal governments, state governments, local council, and also the regulatory agency and industrial associations. Right, so please write them down. That would definitely help you in the future if there's anything you are still not quite sure, or you would like to get more information or looking for some of the information. Please consider going to those organizations or departments' websites. Make sure you try to getting into the official website, because you can imagine there are so many, there are heaps of different websites. You can search, but getting the most accurate and up-to-date information, it would be better to go to the official website. Right? So far, any questions to understanding where you can get the source of information from?
No.
Okay. I think probably some of the regulatory agency, I think I can also recommend you guys to check on the Fair Work, right? In case you want to know what will be your minimum pay rate in different states, yeah? What will be the requirements for a particular role? I think you can definitely go to the Fair Works website to check. I think the day before I just checked on the Fair Work website in Australia nowadays. The minimum pay rate for minimum hourly rate for the care support worker, it is around $33 per hour for a junior aged care workers. So definitely once you're getting more experience, your pay rate will getting a bit higher, right? So just to give you some extra information, so you guys can go to the Fair Work to have a look at their website as well, right? And also, after you know where to identify the source of information, then this part is explaining to you how to accessing those sources. Like, for example, like, let's say if your clients want to know about housing, what's the policy, or what is the relevant informations they can get about looking for accommodation, right? You can help your clients to go to the New South Wales housing or Victoria housing. So I don't know the name of them, but definitely go to their offices. You can look for the officer to ask some of the information. But definitely, I think the most easiest way is to checking the official website. So firstly, when you're getting those information, you may also cross-checking, identifying the author. Some of the website they do listed these journals or those informations are written by somebody, and checking the publishing date. Why it is important to checking the publishing date? Because you can make sure you are getting the most up-to-date information. Some of the information in the website would be probably it is not up to date or it's outdated. So make sure you're checking the dates they publish those information, right? And definitely cross-checking with other sources that to make sure that the information you are checking is accurate and also it's up to date, right? And also, after you getting those information, we do need to start interpreting and understanding those sources. Um, so here I'm giving you some example. Like you may checking so many different informations or source of legal requirements informations, but if you don't understand, so it means it's pointless, right? So it is good important for you guys when you're checking those information. How do you understanding them? But I believe probably the regulatory agencies or the industrial association, the information on their website will be slightly easier to understand. But probably for the government's website, a lot of information they may require you sometimes to understanding it, or even though sometimes it may take a bit more time to find out more information. So it is important for you to make sure, even though you're getting the information, you're able to understand. Okay. So for example, I listed here one of the really common regulations we must follow. It is the Privacy Act, right? So the Privacy Act, it is a every state and the whole Australia, we do follow this Privacy Act. So this legislation is outlining the rules for privacy, confidentiality, and disclosure. Yeah, so it's, for example, it's telling you how the organizations collecting the information from our clients, or what do they use for those informations, and how do they need to protect our clients' privacy, and what do they must do for our clients' information to maintain confidential, and when we need to disclose the client's information, what are the steps and process you need to do, right? It's all clearly outlining into this legislation. So when you're getting those information, try to check on the abstracts. Let's see if they're summarizing what is the key points and relevance to our role. That would help you to understanding those legal and ethical considerations. But also as your employer or as the organization, they definitely do holding the responsibility to protect clients' privacy and confidentiality. So like here, according to the Privacy Act, the organization, they also must collect the personal information only with the client's consent. Yeah. And also use the information only for purpose agreed upon by the person. So that means the organization, they can't just use our client's information wherever they want. They must also getting the consent. For example, your clients coming to our aged care facility, they may attend some activities, right? So we may like to take some photos for our clients and want to publish on the organization's website. Yeah. So if that's what they want to do, they must talk to the clients and getting the consent from the clients. They are happy to. They're happy for us to share their photos or the pictures on the websites or on the newspapers, or even put it into a newsletter, etc. So they must always getting the consent, and obviously that consent is not only the verbal consent; it must be a written consent, right? And it doesn't mean the clients give give you the consent once, and then they will be happy to share their photo forever. So there is the time frame. So for example, depends on the organization's policy. Probably they do need to renew or review those consent form, let's say every year or every 2 years. It depends on the organization's policy, right? So we do always need to check with the clients. And also the following part is to discuss how we identify the scope and also the nature of own legal rights and also the responsibility. So you probably already aware that working as aged care workers, we are holding a lot of different legal rights and responsibility. So in general, here it's showing you some of the legal rights, your legal rights as a workers. So like everyone, we do have a equal opportunities, right? It's not because of you're coming from any particular cultural background and you'll get promoted easier, or because you have your age, then you probably can get promoted. No, it's not regarding this. Everyone would have an equal opportunity. That is our right. And also every workers, we do have entitled to have a vocational and also the training program. Yeah, this is part of the legal requirement for all staff. We need to have continue ongoing training, develop professional developments. And also we do entitled to get our pay rate according to the Fair Work, according to the federal government's minimum pay rate, right? So if you identify that your employer paying you less than the national's minimum pay rate, you can definitely report to the government's departments, right? And also you are entitled to work in a safe and healthy working conditions, right? If your employer asking you to working in somewhere it is unsafe, then you do have your right to refuse to work there, right? So your employer, they need to make sure the workplace you are working, it is safe and healthy, right? And definitely promotion and advancements at work or rest and leisure. For example, as we mentioned, working in the aged care facility or even though in hospital, we are entitled to have our 15 minutes tea break with pay, right? And also half an hour meal break. And if you're working full time, you are entitled to have a 4 weeks annual leave and also 10 days sick leave, right? Depends on how many hours you work in a week. And also, you do need to sign the agreements or the contract with your employer, right? Once you start working in that organization. So your employer, they do need to make sure they're offering you the hours of work that is same as written on your contract, on your agreement. So they can't just say you sign the contract as you work, let's say, 30 hours per week, right? But they only offering you 15 hours. No, it's breaching your legal rights. So if you sign on the contract that's saying you work 30 hours, your employer, they must offering you to work the same hours as written on your contract. But it doesn't mean that they're offering you morning shift only. No, they are only contracted with you about your hours of work, not the places, not the specific morning or afternoon or weekend. No, only contracted about the hours. So for example, if you used to work Monday to Friday from 7 to 3, it doesn't mean that your employer can't change your the day you work, okay? They may change you from working Monday to Friday morning, but asking you to do from Tuesday to Saturday afternoon. They can. That is your employer's right to move you to different hours, to different date and morning or afternoon. But what they can't do is they can't change your working hours, right? But when they change the day you work, they all obviously need to discuss with you, and you agree to do so, right? They can't just force you to the changes, but they do need to discuss with you, right? But as we say, they are only contracted the hours with you, but they are not contracted the specific day you work, right? And for sure, in every organizations, as workers, you are like your employer, they do need to take some measures to against any discriminations. If you do feel like you are being discriminated, collect evidence and also definitely report or escalate it to the relevant departments to uphold your legal right. Yeah, so none of your organization or employer they discriminating any of the staff. That is not tolerated. And trade unions, like as I mentioned to you guys, a lot of staff may feel like it is wasting money to join a union. But I think from my previous experience, I would tell you unions still, it is quite helpful, especially when you have something happens, then they can definitely using their knowledge and also their experience to help you. For example, for care support workers, you probably just need to pay, I think, around $30 per month for your union fee, and definitely because that is work related, and you will get the tax deductions. Because so the fee you are paying for your union fee, you can get the tax deductions at the end of the financial year. I believe your accountants would definitely help you to do that. So you can get the money back. So why not, right? You can get the service as well. And one of the thing union always do is to help us to ask for pay rise. So I think, it's good for someone on behalf of us and helping us to fight for pay rise. Why not, right? And definitely physical accessibility for people with disability, that is the same. If any of the workers, they may have disability, the employer, they should also fully supporting the people with disability in the workplace as well. So those are our basics and also important legal rights. I think every workers should know what is our legal right. Yeah. And also our responsibility, right? So you know your right, and you should also understanding what would be our legal responsibility or obligations. So firstly, once you start working in your industry, we must provide a high quality of care and services to our clients, right? That is part of our duty of care. And this is also written on the code of conduct, to expecting us to do in the same way. And we do need to take care of the health and safety of themselves and others. That means you are not only make sure our clients is safe, we also need to protect others, right? This is also related to the Work Health and Safety Act, right? You are responsible to make sure your client safety, your own safety, and also we do need to look after others, like your colleagues or any visitors in your facility as well, right? That is part of your legal obligation. You can't say, oh, you are not my client, I don't care about you. No, that's not right. You do holding the legal obligation. You can't put anyone at risk, all right? And we do need to strictly adhere to our workplace policy and procedure, right? I think I have emphasized to you guys many times since day one. So you firstly need to know what are the policy and procedure in your organization, and you are not only knowing, you do need to understanding those policy and procedure, and also put that into your daily practices. Right, everything you do, it must follow your organization policy and procedure. That is part of your legal obligations. Right. If you say, because English is not my first language, I don't understand about the policy, so I make the mistakes. Sorry, that's not good enough. Yeah, even though you don't understand, but you should ask for help from your supervisor, asking them to explain to you or help you to understanding it. It is part of your responsibility as a worker. You can't just say, I don't understand, so that's why I don't follow. You can't do that, right? And definitely, your legal obligation is including follow the reasonable instructions by your employer. Yeah. The instruction from your employer that it's not reasonable, or they are putting, you believe that they are putting you at risk, or they are asking you to do something which is not written on your employment agreement, then definitely you can raise your concern. You can ask questions. You can asking why, or you do have the right to refuse to do so. But if those are the reasonable instruction, then you do need to follow. Right? That's why they are your manager. Right? They are giving you the instruction. You do need to follow. That would be the basics, your legal obligation as the workers. Anyone have any questions so far? I would like you guys to write that down, or even to take a screenshot or take a photo about your legal obligations. It is really important for you to understanding. I can give you so many examples of those, but I think firstly you must fully understanding those your basic, really basic legal obligations. Okay. Anyone have any questions regarding any of those legal obligations? Because if you fail to follow any of these, or you breach your legal obligations, then you would have a lot of problem. For example, the simple one, not simple, probably the one is you may get warning, right? You may be dismissed from your employer, they may fire you. And the worst case, you may have some legal issue, right? Because that is your legal obligation. You breach the legislation, or you breach your organization's policy and procedure, and putting someone at risk, or cause death to anybody, or causing any permanent disability to your clients or to your colleagues. Definitely a huge problem. Okay. Anyone have any questions regarding the legal obligations?
No. Okay.
All good? Perfect.
Not yet.
Yeah, someone asking question? Did anyone mention something?
I think you said not yet.
Oh, not yet. Okay, all right. So let's continue. So the following part is to discuss about the children in our workplace. So I think I did mention to you guys previously why we need to discuss, why we need to know the children in our workplace. Most of the time, yes, most of the time we are supporting elderly people, right, or people with disability, but we will still have chance for children coming to visit their grandparents, or visiting or coming into your workplace. So once they step in or walk into your workplace, you are start holding the responsibility to make sure the children are safe. Or we say that keep the children away from any of the hazards. That is part of our legal requirements. All right. You may see some young kids, they coming to visit their grandparents, they're running around in the aged care facility, or they probably would go to different residents' room. They may start crying, yelling, or touching things in the facility. So you do need to think about the following, which is I highlight in the PowerPoint slides. You need to think, all right, are the kids safe in your facility? If they start running around, trying to go into different residents' room, start playing things around in your workplace, are they safe? Do you think what do you think if you see a, let's say, 5 years old boy, he start running in the hallway, when you're pushing the trolley, trying to walk past, and you see the little kids start running towards you, do you think it is safe? Do you think that is safe?
Definitely not.
Definitely not. So
No,
what
no,
would be?
it's not safe.
Yeah, definitely. So what would be the hazards you can? Well, what could be the potential risks you can foresee if you trying to pushing the trolley in the hallway, going to see one of the residents, and you seeing there's a kids start running towards you? What would be the potential hazards or risk you can think of?
They might hit the trolley.
They might hit on the trolley, yeah, and then it may cause them have injury, or they may have a fall, right? Yeah. What else? Any other hazards? That's it?
The trolley can hit elderly people.
Yes, for sure. And some of the, like in the hallway, it's quite narrow, right? If somebody is running around and you're pushing the trolley may also hitting on somebody else, right? In the hallway, yeah. And the kids probably also when the person's running, probably they will get into someone else's room and they can hit on the elderly people, or they may get into some of the staff room or medication room, which is should not be accessed by the little kids, right? So you do need to always think about, if you do see any kids in your workplace, you must think about, is this area safe for the children? And also checking, are the children well supervised? So supervised, it could be supervised definitely by their parents or their visitors taking the kids. They do also holding the responsibility for the kids' safety, right? So we do need to remind their parents to supervise their kids, right? And also checking the clear policy on how to interact with children. Yeah, if you see any kids in your facility, it doesn't mean that you can take them out of the facility without informing anybody, or how you interact with children. That would also be clearly outlined on your organization policy and procedure. So make sure if there's anything about children's safety, that is also part of our priority in our workplace. Even though we may not always have children in our workplace, but in case if you do so, make sure you know what to do to protect the children's safety. Okay. And sometimes, like nowadays, we do have some colleagues that may need to bring their kids to the workplace while they are at work. Yeah, some of the facility or organization, they do welcome their staff bringing kids into the workplace. So if that is the case, they definitely would have a clear policy to how to make sure the kids' safety. So if your organization, they do have something like this, please read through all of those information and make sure you know how to, you know what to do. Okay. And also, we all need to comply with the legal requirements for working with children. That's why if you going to work with disability services, you do need to hold a WWCC, which is we call Working with Children check. Right? You do need to check, make sure you don't have any criminal cases related to children, etc. They would. I'm not quite sure in other states, but in New South Wales, you do need to fill out a form and complete all of those questions. They would the service New South Wales, they would check your background to see if you have any criminal history or anything that is putting the children at risk. If no, then they will you just need to pay, I think, around $90 something. Then you will get a certificate. So that's WWCC certificates that is valid for 5 years. So that means every 5 years you do need to renew this WWCC if you still want to continue working in this industry that you may have chance to working with children. Yeah, especially if you going to work in disability services, you would have chance that your client is a children under 18, then you must hold in this working with children check, right? And definitely we do need to monitor the behavior of the workers around children, right? So that is also your managers and your supervisors' responsibility to make sure their staff their behavior, the staff behavior with children is appropriate, right? And implementing the policy and procedure on interacting with the children, which is we mentioned earlier, that is more about your organization they need to do, having a proper policy in place, and also they do need to train and educate the staff what to do when there is children in the workplace. Okay? I think in Australia they treated this really seriously. Okay, they want to make sure children's safety. It is not joking. If it's anything at risk for the children, that it's a really serious problem. Right? And here it is our everyone's responsibility, not only the manager, not only the workers, it's everyone's responsibility to make sure the children's safety in our workplace. So as we say, they need to include the child safety practice in the policy, that is to make sure staff member knowing what to do. And also they would need to have some control access for the children. Like we say, make sure the nurses station's office is closed at all times. If there's no one inside, you make sure you're not leaving the door open, because if there's children, they may get into your nurses station and start taking the medication or play with the needles and scissors. That is really dangerous, right? So you do need to make sure some of the area that is fully prohibited and not allowed any children to get inside, including any other area you can think of that should not be accessing by children in our workplace, in the aged care facility. Other than nurses station, can you think of anywhere else that should not getting the children inside?
Maybe the warehouse.
Where, sorry, in our workplace? What house?
Warehouse.
Warehouse? Our aged care facility doesn't have warehouse. I mean, in our workplace, in the aged care facility, any other area in the facility that should not allowing the little kids access to those areas? Kitchen, definitely. Anywhere else?
The stair for fire escape. You know, sometimes they leave the door open so then go smoke in the stair.
Yeah, for sure. And also don't forget the chemical room, right? those area keeping the chemicals that is always at all times that need to be locked. Only certain people or staff they can access to those area. So definitely it's not a playground for the kids. So like we say, medical like medication room, nurses station, because in the nurses station we keep a lot of clients' documents, right? So even though you're not sure the kids would read your documentation or not, but still, nurses station it is not for the children to get inside. Kitchen, as we say, and also the chemical room, right? And the smoking area, like you said, definitely it's not the access for children. And as we say, we do need to make sure the children are supervised at all times. So the parents, they can't say, oh, I'll leave it my kids with their grandma for half an hour. I just go out and buy a cup of coffee or something and come back. Well, no, they can't just leave the kids with unsupervised. But definitely they can't expect our staff to manage the kids. They are still holding the responsibility. So it is part of our job to let the family member know they do need to supervise the kids at all times when they bring the kids in the facility. Okay? Any questions regarding children's safety? Okay. Nowadays, some of the new aged care facility, they do start having some like a multi-purpose room or some area that's is designed for the kids. So when they're coming into the aged care facility, they can actually access to those like kind of a playground, or in the room that there are so many decorations or even toys that it's for the kids to play with. Especially if there's more than one kid in your facility, then we encourage the parents to, or even though the elderly people, they can sit in that play room with their grandkids, right? So that would be easier to supervise, and they can also spend some private time with the elderly people as well, with children, right? So I think nowadays there are more and more supports for children, even though in our aged care facility as well. All right. Okay. So the following we would like to discuss is also one of the key legal and ethical requirements is you guys, all of the aged care workers, we must follow the code of conduct and code of practice. Did I explain to you guys previously about the code of conduct and code of practice? I can't remember because I've done so many classes. But anyway, if we haven't discussed yet, let's go through this together. So the first one on the left-hand side, it is the code of conduct. So code of conduct, it is a document, or it is a guideline to outline how employee should behave at work. So like we say, it is a guideline, 1, 2, 3, 4, 5, they listed all of those appropriate behavior you should, or what you shouldn't do, or what you should do in your workplace. So probably you guys are aware that we do have the aged care code of conduct, right? That is also I'm going to show you. That is listing for you. You're working in aged care. What is your proper behavior? What do you need to do to following this code of conduct? And this code of conduct, it is a standards to telling all of those aged care workers. As we say, we always need to respect our elderly people. What do you do is calling a respectful behavior. That would also mention it into the code of conduct. Yeah, it is kind of setting you a standards. You definitely can do above standards, right? But you can't do below the standards. Everything you do, it must meeting those standard level, right? So it's telling you the level is here. You can't go below, right? And also the code of conduct, it acts as a guide for ethical and responsible actions. That's all we say. For example, like we mentioned it, respectful behavior. What is the definition about respectful behavior? What do you do is calling as a respectful behavior. That would also showing to the code of conduct. And I gave you a example of the relevance code of conduct for us. It is the HK code of conduct, right? I'm going to show you in a minute. And also in the right-hand side of the PowerPoint slide, it is another document. It's called Code of Practice. It is not only a document. It is a code of practice. It could be also a guideline from the relevance government association, government departments, or the industrial associations, right? But most of them, it is based on the legislation and also the regulation. So code of practice is providing us the rules and guidelines for a specific industries. For example, I listed at the bottom the WHS code of practice. Okay, is everyone remember what WHS stand for? Anyone? What is WHS stand for?
Work health and safety.
Correct? Work health and safety. So as you may know, that work health and safety, it is a legislation. We do have one of the units that specifically go through everything about work health and safety in our workplace, all right? But yeah, as you know, work health and safety, it is a legislation and it applies to every industry in Australia. It not only applies to aged care or disability, that is a legislation that every workplace, every industry, they must follow this legislation. But there are more specific requirements like for example, in aged care. So work health and safety code of practice, it would be one of the example. And also in code of practice, they explain how to apply the legal requirement in our workplace. For example, in work health and safety, as the employee, we do need to facing different type of work-related risks and hazards. For example, manual handling risks or infections risks, right? So those are all related to work health and safety. Then the code of practice is going to list it for us. How do we need to do to following the law and legislation related to work health and safety? All right. So I try to help you to understanding the differences between code of conduct and code of practice. So code of conduct is more a guidelines for every workers in your own industry, what you should behave at the workplace. But code of practice, it is published or developed by, I would say, by the government departments or by the relevance industrial agency, right? They are the group of people to develop this practice and outlining the what you need to do in terms of following the legislation. They do apply for a specific industry. Okay, every industry, they do have their code of practice, but some of them, they are overlapped, right? For example, you work in aged care, we do need to follow the work health and safety. Working in the construction site, they also need to follow the work health and safety, right? They do have those code of practice. So we have a look the following video that is to explain to you what is the aged care code of conduct, especially from the new Aged Care Act since the 1st of November, just a couple of days ago. So they updated the new aged care code of conduct, right? So I would like all of you to take some notes, to write down what are the code of conducts for working in aged care, what would be the expected respectful behavior all of us should have when we're working in aged care. All right, please take some notes. That is really important.
The Aged Care Code of Conduct, also known as the Code, is in place to ensure the safety, health, well-being and quality of life of older people receiving aged care, regardless of who delivers that care. It does this by empowering older people, promoting respect, and building trust in the care they receive. The Code will help you better understand what is expected when delivering funded aged care services to older people. The Code applies equally to all registered providers, their responsible persons, for example, board members and chief executive officers, and aged care workers. This includes people employed by the provider, those who are employed by an associated provider of the registered provider, as well as volunteers. The Code doesn't apply to visiting medical practitioners, pharmacists, and other allied health professionals and tradespeople who perform work that is not under the control of the provider. For example, those visiting for a one-off maintenance task. However, these visiting medical and allied health practitioners are still required to provide safe and respectful care and behave in a way that aligns with the Code. The requirements of the Code should already be familiar to you, as they are consistent with your existing obligations. Providers, responsible persons, and workers must act in a way that is respectful, kind, and consistent with the behaviours set out in the Code.
So that is the first one. Please write it down. All of the staff, you do need to respect the clients. Right?
Providers have the additional obligation to take reasonable steps to make sure their aged care workers and responsible persons comply with the Code. The Code includes 8 requirements, which mean you have to act with respect for individuals' right to freedom of expression, self-determination, and decision-making in accordance with applicable laws and conventions. Treat individuals with dignity and respect and value their diversity. Respect the privacy of individuals. Deliver funded aged care services in a safe and competent manner with care and skill. Act with integrity, honesty, and transparency. Take action on quality and safety by promptly responding to issues and concerns. Deliver funded aged care services free from all forms of violence, discrimination, exploitation, neglect, and abuse, including sexual misconduct. Take reasonable steps to prevent and respond to all forms of violence, discrimination, exploitation, neglect, and abuse, including sexual misconduct. If you act in a way that is not consistent with the Code, the Aged Care Quality and Safety Commission can take action. This might include issuing caution letters. In the most severe circumstances, providers, responsible persons, and aged care workers may be banned from being involved in aged care in the future. The Commission can also take compliance and enforcement action against registered providers. Any action that we take will afford you appropriate procedural fairness to have your say. To learn more about the Code, your obligations, and other aged care reforms, visit the Commission's website.
Okay, so did you write down anything about the Code of Conduct? What are the 8 what are the 8 conducts that we must follow as the aged care workers? Did anyone write down anything?
It was everybody must act and show respect to the patients at all times.
No, they're not the patient. They are the clients. right? Or the residents. Yeah, we don't call them as patient. Yeah, correct. So we do
Yes.
need to. Sorry.
No.
Yeah. So
Busy ones.
we do need to act and respect the individuals, right? Our clients. What else?
It's like I don't think that's the word prevention, but I think it's like act and prevent discrimination, physical abuse, and sexual abuse.
Yeah, definitely. So as aged care workers, we are holding the responsibility to prevent and also avoid um, any forms of abuse and neglect and exploitations to our elderly people. The second and the third one is you're not only to prevent if something happens related to elder abuse or neglect, you must respond it in a timely manner and also make sure our client's safety. Right. So the first one is you do need to know how to prevent, but the second is if something happens, you know how to respond it. Right. That is also a part of the conduct. What else?
Respect for freedom of speech.
Yeah, respect the freedom of speech. That means our clients, they do have the right to raise their concerns. They can make complaints, right? Okay, what else?
Treat everyone equally.
Treat everyone equally, yeah. So, and something like we do also need to provide a high quality of care and services to our clients, right? That is also part of the conduct. What else? There are 8.
Report concern or risk.
Report concern and risk, yes, we have mentioned that. What do you do in terms of privacy?
Yeah, protect our client's privacy.
Yeah, so definitely that is part of the conduct as well. Yeah, you do need to protect our client's privacy. It's not only about their private informations. You do need to protect all sort of privacy, including like when you get into your client's room, make sure you knock the door and wait for the permission before you get in, right? Or when your client's in the having a shower, you do need to protect their privacy by closing the curtains, probably getting a towel to cover their private area, to avoid their exposing their bodies with others during showering or toileting, right? So those you do need to protect their client's privacy. What else?
Ensure the safety and well-being of clients.
Yeah, definitely. Okay, ensure your clients' safety and their well-being. And you remember, safety and well-being is not only about the physical well-being, yeah, not only about their health. It's also including what else? When we say to ensure our clients' safety and well-being, what are the type of well-being we do need to
Mental health.
mental health, yes, and physical, mental health, well-being, and what else? Only 2? What are the different type of well-being?
Emotional well-being.
Emotional, mental health, physical, and
Emotional being, healthy,
Spiritual.
Social.
spiritual. Yes, spiritual, cultural, excellent. So physical, financial as well, right? Financial well-being, mental health or psychological, emotional, cultural, spiritual, all of those. That's part of our responsibility. Okay. if you haven't written down the aged care code of conduct, I will recommend you you can Google this video and try to probably watch this video again, or save this video on your laptops, and then make sure you're familiar with all of those. Okay, it's really important. All right, so let's continue. The following legal and ethical requirements for all of us, it's about complaints management. You may think, oh, well, I'm not the management team. Why do I need to managing and knowing about the complaints management? That actually it's not only your employer's requirements, it's also same for the staff as well. So you as a staff, you do need to know how to handle any complaints or any feedback from our clients. So if your clients ask for your supports about making their concerns and feedback, you can fill out the feedback form on behalf of your clients, right? For example, if Mary, your client's telling you, oh, I'm not happy about the laundry service today, then you can start asking your clients what is the key details. Can they tell you a bit more? Then you can help your client and asking your clients, would you like me to fill out a feedback form for you? Right, so you can start writing, capture all the information your client's telling you, and complete the feedback form. Right, so that feedback form you completed, you can give it to your manager, and also most of the facility, they do have their complaint letterbox, right? So that is locked, and only certain people would have the key to open the letterbox. You can put that the complaint form into that box, so the manager could definitely follow up. But those information that need to be confidential, all right? Probably your clients doesn't want to share their feedback and complaints to other residents or other staff, or they want to make a complaint to particular staff, so they don't want to disclose, right? So all of those need to be handling in confidentially. Definitely, it will be your manager's terms to start following up. They do need to check on the letterbox regularly to make sure they're handling the complaints. And in each organization, they must have a really clear and easy to follow complaint process. They need to train the staff how to support the clients to make any feedbacks and complaint. And also, don't forget, you as a support worker or you as a staff in the organization, it is also your right to raise your concerns and make a complaint as well, right? So that process also applies to you. If you are feel like something you do have concerns, you are not only verbally talk to your manager, you can also fill out the feedback form and hand it over to your manager, so they can start following the organization's complaint management process to do some investigation, collect some evidence, provide everybody or the residents or you some relevant strategies how to address those concerns you raise, or the concern raised by the residents or their family member. And they do need to get back to the clients or the staff in a timely manner, right? They can't just say, oh, you wait until next year. No, they do need to get back to us what would be the relevant strategies to address those issues. And also they do need to have a meeting or have a consultation with the family member or the clients to see if they're happy about those strategies. And they do need to come back and evaluate to make sure all of those strategies have been implemented, working or not, right? So those the complaint management. That is part of the aged care standard as well, right? For example, the Aged Care Quality and Safety Commission auditor, they will interview the residents or they will interview the client. They will asking them some specific question. For example, are you happy or do you know how to make a complaint and feedback in this organization? Do you feel supported by the staff when you have concerns and feedback? Right, those questions they will ask the clients. If your clients say, no, none of the staff showing me how to make the complaint, what is the process of making complaint, and or they may say, I feel really difficult. No one actually following up my concerns. Having a problem about your complaint management part on the aged care standards, right? So that's why you do need to know what is your responsibility in terms of complaint management. Okay, and as we mentioned previously, feedback is not always only the negative feedback. That would also including positive feedback. So we do encourage our clients to give us some positive feedback as well. If they believe the staff are doing a really good job, also a feedback form. Yeah, or some of the organization they would put their feedback form as a digital form, so you can just type it on the iPad or on the computer, then you can submit your feedback form as well. So, and in other terms, feedback and complaint will definitely help us to improve our services and care. Right? That is also one way that why we need to do a survey, or why we need to do a questionnaire, or why we need to having a meeting with our clients and family member. It's because we want to hear their feedback, that we're utilizing their feedback to improve our care and services, right? So we don't scare to seeing any feedback and complaints from our clients. They are actually helping us to improve our services, okay? And sometimes please don't think no feedback or no complaint that is the good sign. In the auditor's perspective, if you have none feedback and complaint in last couple of months, they will putting a big question marks that probably the staff don't know what feedback and complaint is. They probably did not supporting the clients and asking or getting the feedback from them, and also probably the management team, they did not fully supporting or knowing what is happening in the aged care facility. So, as we say, zero feedback and complaint is not a good sign. Every facility, I'm sure, they would have some residents, they are not satisfied with the foods or not satisfied with the care or whatever. They would have some concerns or idea. So make sure regardless the positive feedback or negative feedback, we do need to actively try to seeking some feedback from our clients or the family member. Okay, some of the facility I have been previously, they have zero for the last couple of months. They said when we interviewed the management team, they said no, the clients they're really happy. None of them raised any of the concern. But actually, when we interview the clients, a lot of clients they are mentioned, oh, the food is not tasty. The staff are not taking me out for activity. Are always just sitting in the room and doing nothing. Or the family may say, oh, I haven't received any update from the staff for 2 months, etc., etc. That is actually the feedback and the complaint, right? So you guys do need to collecting your clients' feedback. That is part of our requirement as well. Any questions regarding complaint management?
No.
No? So you're clear what you're supposed to do in terms of complaint management?
Yes.
I'll always ask your clients, is anything else you would like me to do for you? Are you happy with the service or the care I just provided? Any feedback? You're welcome for all the feedback, right? And make sure you're familiar with your organization's complaint process. And also, when you start working in the aged care facility, you will definitely see a lot of posters displayed in the facility, in the hallway, even though in the lift, right? That is supporting the client or the family member that know the process of making complaint. For example, they will list your manager's name, contact number on the poster in the lift, or they'll display it in the hallway, or even though they would keep posting your manager's contact details on the newspaper on the newsletters every month. So that is to encourage the clients, when they have any concerns, they can easily follow those process, or they can just scan the QR code to liaise to contact with the management team. I do see one of the students raise her hands. You want to asking any question?
Yeah, I wanna asking.
Yes.
So every residents have a special needs, right? Maybe like some residents love to like, can you comb my hair? Or maybe some residents need something special.
Mm-hmm.
And let's say that residents they feel like we didn't give their special needs, and they give it a complaint or a feedback. So what we should do, I mean, like we should adjust the services only for the residents or in general. I mean, everyone's have a different needs.
Yeah, so like your case, if a specific residence, they do have their special needs, then definitely we do need to adjust our care to meet our clients' needs. But in case if you have more than one, let's say 2 or 3 residents, they do have a similar concern, then that means that is not only one resident's needs, and probably it is for a numbers of residents' needs. So then at this time, as a staff, you are not only meeting one person, you do need to, like following this, the feedback and complaint process, to raise those concerns to on behalf of your clients to your management team. So you can either, like as we say, complete the feedback form, submit it to your client, submit it to your supervisor, and also verbally talk to your manager regarding your client's concern. Let's say if your client, like there are 5 or 8 clients say, oh, today's meals is terrible. It's the meat is too rough. I can't even chew it. Right? And then the other resident say, yeah, I agree with you. Yeah, I can't eat it. Or even though you see, even though the clients did not make a verbal complaint, but you see a lot of clients there, they did not finish their meal. They left their foods on the plate. Then you probably start thinking, there must be something wrong with today's lunch. Then you can let the chef know, right? And you can write down, fill out the feedback form, give it to your supervisor. Did I answer your questions?
Yes, thank you.
Yeah. So if it is a individual case, then definitely we deal with that person. But if it's a general or more than one clients have a same concern, then definitely we're managing differently. But definitely we can't just ignore it. Regardless it's one person's concern or it's 10 persons concern, we do need to follow up as per your organization's complaint and feedback management process. That is also another aspects the auditor would focus on, and checking if your client is satisfied with the care and services for this facility. If And definitely all of those feedback and concern, your manager is responsible to record it into a feedback register. Yeah, probably you guys would not have chance to see the register. It will most of the time dealing by your management team. But that is also one of the documents and evidence your manager would show the auditor about how you managing all of those feedback. What is the time frame they close the feedback, if close the complaint? For example, if your clients raise a complaint on the 1st of November, and then when the auditor come and check, they see it's already 2 months, your complaint still open, this case still open, has not been closed yet. They will start asking you to show them more evidence. How do you normally managing? They may also interview the family member, the clients, and the staff regarding all of those. Right, so your management team, they do have a lot to do regarding complaint process. But in case for you guys as a support workers, I think the minimum requirements for you is you familiar with the process, right? And you supporting your clients, they do feel safe and comfortable to raise any of their concerns and feedback, including positive feedback, right? That is what we am writing or completing the form on behalf of your clients to submit those their concern to your management team. Any other questions regarding complaint management? No? All right, so we have a quick 10 minutes break. Now 11:30. Please come back in 10 minutes. Then we will continue for the rest. Okay, so see you guys in 10 minutes.
Okay, see you.
Yeah.
Thank you.
Thank you, Tracy.